Hello everyone, today I'm going to present about diabetes prediction model by comparing three different classification models. Diabetes is a complex disease with multiple cause factors. According to Center for Disease Control and Prevention, nearly 11% of population in US have diabetes. Nearly 1 in 4 people with diabetes do not know they have diabetes. In 2019, diabetes was listed as the seventh leading cause for death in United States. Diabetes is a costly disease. In 2021, the total direct medical cost for diabetes is around $300 billion. These statistics shows that diabetes is a serious public health problem. The prevalence of diabetes is increasing and the disease is a major contributor to healthcare costs and deaths. I selected the dataset which contains more than 60,000 health records of individual with their medical details such as BMI, hemoglobin A1C level, and glucose level in the blood, along with health conditions such as hypertension, heart disease, along with smoking history. With these features, I have formulated the model to predict diabetes. So, collaborative data sharing platform with integration of electronic health records will enable the early detection and prevention of diabetes. These electronic health records will act as an input data for our machine learning model. Based on that, we can provide a personalized treatment and suggest modifying the lifestyle. This will have a potential impact on reducing the burden of diabetes and its associated complications. Since the target variable is binary classification, I have selected three classification models as logistic regression, decision tree, and KNN classification. When it comes to evaluation metric, we have to formulate confusion matrix. In the confusion matrix, our aim is to minimize the false negative cases. In this scenario, false negative cases leads to person with diabetes not being diagnosed. In this scenario, false negative is basically a person who actually has diabetes but our model fails to predict. So this will delay the treatment and also leads to further complication. We need to minimize the false negative cases. On analyzing the data, we can say that people with diabetes are more likely to be overweight or obese. Further, people with diabetes often have poor controlled blood sugar levels. It's because diabetes is highly correlated with blood glucose levels. Further, diabetes is most common in older adults. Logistic regression provides easily interpretable statistical output for a classification problem. When it comes to model evaluation, the model is able to correctly predict the diabetes with high accuracy of around 95%. In overall, the model seems to be performing well on a testing dataset with high accuracy and good balance between precision and recall. This suggests that the model could be used effectively to predict the diabetes risk in a real world setting. Precision recall curve. Precision recall curve is a valuable tool for evaluating and fine-tuning the logistic regression model. It provides the overall view of performance by including precision and recall with different threshold values. So based on the precision recall trade-off curve, we can observe that the threshold value decreases below 0.5, the recall also increases. When the threshold value increases above 0.5, the recall is decreasing. And also we can expect a high variation between precision and recall in these scenarios. So at 0.3, we can expect a good balance of precision and recall. In the optimized threshold value of 0.3, the recall is dropped from 87% to 74%. In our model, it is more important to identify many patients with diabetes as possible, even if the model making some false positives cases. But the fine-tuned model have increased false negative cases. Decision tree can rank the features based on the importance in the classification problem, and it also can handle non-linear relationship between the features and the target variable. So when we are evaluating the initial model, all the parameters has been dropped in the testing dataset when comparing with the training dataset. The extremely high accuracy and precision, perfect precision on a training dataset indicates that there might be a overfitting. The model might have memorized the training dataset and leading to reduced generalization on new data. So the model need to be fine-tuned to prevent the overfitting. So we need to prune the decision tree to reduce this risk. Overfitting occurs when the decision tree model becomes too complex or learns the training data too well, and this leads to poor performance in unseen data. To avoid this, we need to prune the decision tree. Basically, pruning the decision tree will help to simplify the decision tree, and it can improving its generalization ability. So I use grid search CV to reduce the overfitting and to find best hyperparameters to our pruned decision tree. Based on the results, our pruned decision tree will have maximum depth of 2 levels. That means like our pruned decision tree will be a shallow tree. A leaf node can contain as few as one sample, and the internal node must have at least 2 samples to eligible for further splitting. When it comes to evaluating the model performs better in a testing dataset than in a training dataset, but we can observe high number of false negatives and false positive cases. KNN classification. KNN classification is a simple and effective algorithm that is known for its robustness to data with outliers. When it comes to our model has high accuracy and recall on training and testing dataset, but we can note that the model has relatively high false negative rate. Almost 25% of cases are false negative. So we need to fine tune our KN classification model. So we used a method called cross validation. Cross validation can help to prevent the overfitting and to improve the model generalization ability. Basically, cross validation involves splitting the dataset into multiple subsets, training the model on a different combination on a training and testing datasets. It will help in avoiding overfitting and improve generalization. So based on the cross validation method, we can find the optimum K value as 13. So we run the model again with the optimum K value as 13. After fine tuning the model, a precision is increased but the recall is decreased. On comparing these three models, the logistic regression with threshold value of 0.5 has the lowest false negative rate. So we can use this model to integrate with electronic health records to identify diabetes. So based on our model, the people who have age above 45, BMI above 27, elevated blood glucose level above 130, and elevated hemoglobin A1C level above 6 are at high risk of having diabetes. Based on analysis, prioritizing early detection for younger and middle-aged adults are highly recommended so that we can prevent further complication of diabetes. So maintaining a healthy BMI of around 18.5 to 25 is highly recommended to reduce the risk of having diabetes. Increased blood glucose level and increased BMI will lead to insulin resistance and even actually increases the risk of having diabetes. When it comes to association with prior health condition, a person who with a hypertension, 3 in 10 has diabetes. When it comes to heart disease, 1 in 5 have diabetes. So predicting diabetes would help the healthcare system in diagnosis. In future, as these models continue to develop and refine, they will play a crucial and important role in identifying the diabetes and improving the healthcare system.